Hi, I'm Dr. Chow from the Emergency Department. I would like to make an introduction about our department and what you can learn here. Every hospital has an emergency room, but do you know what ED doctors do and how we do it? In simple, we save lives. We manage the most critical patients in the hospital. And not just in the hospital, we also stand in the front line of every disaster. These are the pictures of major accidents or disasters that are ED involved in the last 2 decades. The airplane crash, the major earthquake, the massive burn casualty, and of course, the COVID-19 pandemic this year that we all involved. If it is in the US Navy, then we are the Navy SEALs. We deal with all kinds of emergent and difficult conditions. Another feature of the ED is that we provide medical services around the clock all year. Patients come in any given time without reservation. Our hospital, the Changgung Memorial Hospital, is the largest hospital in Taiwan with a 3,600 bed capacity. Our department is also the busiest and the largest ED in Taiwan. We have approximately 180,000 patient visits every year. We are a level 1 trauma center. We receive transferal patients from our neighborhood hospitals. We provide emergent consultations of all specialties. For instance, we can do emergent endoscopy for massive GI bleeding patients, coronary angioplasty for myocardial infarction patients. We have our own CT and MRI machine in the ED only for emergent use. When you come, you will be scheduled within each of these designated learning areas. Different learning objectives will be set in these areas. For instance, you will learn how to resuscitate a patient in the critical area, and then you will learn post-resuscitation care in the ED ICU. You will learn how to manage a trauma patient in the trauma area. Our ED is equipped with various clinical learning activities. We have our own meeting rooms, library, several ultrasounds, and we use Clinical Skills Center for simulation learnings. We have a computerized system for learning material, for portfolio, and for feedback. We also hold high fidelity simulation training for different levels of learners. We use different scenarios to form our teaching cases, like child abuse, burn injury, major trauma, or respiratory failure with intubation. As an ED doctor, we love all kinds of activities off work. You will find that we are a group of kind and friendly people who enjoy life. We hope you enjoy your stay in Taiwan, not just in clinical learning, but also the whole trip. So welcome to include us in your future learning plan. Thanks.